My name's Tom Baker. I am the William Malmese Professor here at Penn Law School, and I'm currently the Deputy Dean. And I'm sitting here this morning with Angus Corbett, who's visiting us from the University of Technology in Sydney, Australia. And Angus has spent some time with us as a visiting scholar working on a project that we'll be talking about. So Angus, why don't you, what is it that you've been spending your time on here?
Well, since I've been here, I've been writing a book on the role of governance and law in reducing preventable harm in health and hospitals. And it's really had two bits to it, which explains why it was a good idea to come to Penn. One bit of it is about regulation and law, and the role of regulation in law in reducing preventable harm. And the second bit is looking more broadly at how hospitals, and while I've been here it's nearly all hospitals, but there's a subsidiary question about how roads authorities actually organise themselves, or not as the case may be, to reduce preventable harm. So for the first bit of my time here, I've been thinking about the role of the way in which regulation and law, particularly negligence, has a role in potentially enabling the systems that have the capacity to reduce preventable harm in hospitals.
So what are the systems? What do you mean by the systems?
Systems. Okay, if we think about the hospitals, probably the most important change that's happened in hospital and healthcare generally is a shift from an individualised model of care where we think about a particular interaction between a particular healthcare provider, healthcare professional and a patient. And if we think about even up until the 1990s and the Harvard Medical Practice Study, we were primarily concerned about, in that study, with negligence and the way in which negligence made healthcare less safe. So the Harvard Medical Practice Study was really set up to look at whether negligence and malpractice really existed and whether it was something worth addressing to make health safer. Sometime in the next decade, between 1990, when the Harvard Medical Practice Study was finally reported, and 2000, when To Err is Human was published by the Institute of Medicine, we came to think of healthcare as a system, a process, which produced relatively high levels of injury, what we came to call preventable harm. So in 2000 it was announced that there were up to 98,000 deaths a year caused by medical error and significantly higher levels of serious harm. And lots of people have challenged the numbers about the numbers of deaths, but the thing that stuck is the notion that you as a patient can enter the healthcare system, either by way of a general practice or through a hospital, and what happens to you is largely dependent not just on the skills of the provider, but also on the process that you go through and whether all of the people involved actually fulfill the sorts of expectations that people have. So if you go to radiology, does the radiologist read the script? Does the film, does the information get to the doctor at a time that's useful? Has the doctor correctly diagnosed? Once you're diagnosed and in a specific form of treatment, do all of the persons involved, the pharmacists, the doctors, the nurses, interact and integrate so that you actually receive the care that you're intended to receive?
And what is it about Penn that makes it this
well,
a good place to study that?
Penn is good and interesting for two reasons. One is that Penn, not uniquely but specifically, has a big area of scholarship and interest in regulation. So it's the program on regulation and governance within the faculty. Now, there's a number of places that do have an interest in regulation, but also Penn has, through members of faculty here, Kerry and yourself and others, a connection with not just the European world, but also the Anglo-Australian world of regulation. And so that's a body of work that people here are familiar with, so that it was both a connection for me because the people involved here are involved in that tradition, but they're also involved in an American and a European tradition. So that's a useful, important thing for me. And being able to do the seminar here, which I did on the role of law in enabling the systems to reduce preventable harm, was very good at getting me to focus on that question in the context of a group of people who are really familiar with the problem in this country, but also the kind of broad regulatory tradition. So that's the first reason. The second reason Penn was really good is the broader university is very oriented towards interdisciplinary studies. So while I've been here in the second half of my stay, have been talking to the hospital of the University of Pennsylvania and the Dr. Neil Fishman, who's the infectious control program director, about the hospital's programs to reduce catheter-related bloodstream infections, which is a very important example in the healthcare industry of reducing preventable harm. And Penn has made the hospitals at Penn have made a really significant program to reduce that preventable harm. So I've been able to talk with them about how they've done it, why they've done it, and how their thinking fits within the broader thinking about preventable harm in health. But I've also had the advantage of being able to talk to the people at Wharton, and it's been important for this reason. One of the new areas not new areas, but one of the existing areas of interest in reducing preventable harm in health is the role of networks, particularly organisational and social networks. And so one of the things I've been able to do is to talk to a number of people in Wharton about networks. So I've actually been able to draw on their expertise, and particularly Christoph Vandenbolt from Wharton is really very generous and helpful in giving me a kind of brief introductory guide to networks, which I'd read about, but he kind of really solidified
And does
that.
he study networks in hospitals in particular?
No, his interest is networks in marketing. And
so it's interesting. So you're really doing what interdisciplinary law professors do, which is kind of connecting the medicine with the broader network theory and pulling it together in the context of your research.
That's right.
So when is the book going to be done?
The book is, I've done a significant amount on the book while I'm here, and I'm looking give it a big push through till the Australian summer, which will be next February. That's when I'm aiming to have a draft of it done.
And what's the big theme of the book?
The big theme of the book is really, again, drawing on these two things. It's posing what I think is a major question of significance in law, which is that if we normally think about regulation and law, we think of using law to try and encourage people to do the right thing. That's one model of regulation. And we often assume in that they know what the right thing is, that what they really need is the right incentive structure or the right stick to give them the push to do the right thing. What's fascinating about the preventable harm, and what I'm really focusing on, is how does law interact with systems which are emergent, in which the systems and the participants in them don't really know how to do what they're doing.
And so by emergent, you mean that they're just figuring it out? They're emerging?
They're figuring it out as they go along. So in healthcare, it's not like the level of injuries and preventable harm happens because people are just not focusing on the problem. There's no doubt that people could give more attention to it, but like every undertaking, there are a lot of things baying for attention. So the problem isn't really attention. The problem is that we don't really know, and participants in healthcare don't really know, how you combine all of the elements involved in the process of care into something that's oriented towards safety and quality of care. So, and then that's part of the shift from this individualised model to a more process model. And so really, when you're thinking about the role of regulation, you're not thinking about encouraging people to do the right thing. What you're really thinking about is what's the role of law in enabling or facilitating systems to move towards the kind of dispositions which are more likely to produce reductions in preventable harm.
So changing gears entirely, so how was it like to be in Philadelphia?
Lovely. I was here for a great winter. Not all the people living here thought it was a great winter because there was a lot of snow, but I really loved that. And I've enjoyed a lot of good restaurants. I've had a very fun time. I've been to listened to some great music. I've enjoyed walking around walking around the city, walking down to Rittenhouse Square, enjoyed lots of good coffee, lots of good food.